Hello, everyone. How are you doing?
Hello.
Hi, Lupo. Hi, Tawandra. Great. Well, it is my great pleasure today to introduce Lupo Geronazzo-Alman in our global psych-epi group. He is an assistant professor of clinical psychology here at Columbia and the New York State Psychiatric Institute, where he primarily has focused on studies related to psychopathology, trauma, complicated grief, dabbling in transmission of psychopathology, as well as inappropriate internet use and gaming. Tawandra is an assistant professor in the School of Social Work at the University of Wisconsin. And she has been focused on, I'm going to talk to us a little bit about today about the iatrogenic effects of incarceration, especially as it relates to vulnerable populations as they relate to health outcomes in HIV and substance use. So I welcome everyone here. Lupo, maybe we'll start with you. And you can share your screen.
So I'll just share the screen, right?
Sure.
Yeah. Okay. Can everybody see the slides?
Yes.
Okay, great. Thank you, Larkin, for the introduction. Yeah, so today I will talk, I will show some preliminary baseline findings from a representative study of families. Families include parents and children. So families of parents who are involved with the criminal justice system compared to control families, meaning families of parents who are not involved with the criminal justice system. This is just a brief introduction about the state of incarceration in the United States. The United States has the highest rate of incarceration in the whole world. For example, in 2020, the estimates of the total incarcerated population were over 1,675,000. But as you can see from this graph, the rates have been very high. This is just looking at the past 2 decades. Rates have constantly been high. It's not only people who are incarcerated, so people who actually spend a considerable amount of time in jail. That another problem is the very high number of people who are arrested each year and maybe just held, you know, in a city or county jails for a few hours or for a few days. It's each year there's about 14 million adults in the United States who are arrested and held in jail for a short period of time. Another problem is recidivism, meaning the fact that people who are released from prison, 60% of people who are released from prison, more or less, are usually reincarcerated in the next 36 months. So then the question is, what happens to the children of people who are incarcerated? An obvious result of the high incarceration rate in the adult population is that over 5 million children, which is about 7% of all children in the United States, have had a parent who lived with them and who was incarcerated, so who went to jail or prison. Another problem, as you may know, is that incarceration in the United States is disproportionately concentrated among minorities, for example, Hispanics, Hispanic population, African American population, and is highly concentrated in poor areas, in rural areas, and among children of parents with low educational attainment. This is just to mention a few of the risk factors. So such an alarming high rate of parental involvement with the criminal justice system, which I refer to as CJSI for short, suggests that it would be very important to study the effects of parental incarceration, parental CJSI on their children. In fact, there's a lot of research that has been done in adults who have been incarcerated, but far less attention has been paid to the potential negative consequences of parental incarceration on their children. Despite the limited research, there is evidence that parental imprisonment or other types of involvement with the criminal justice system lead to negative consequences on their children. But you know, this may be if you want, common sense, and it may be a logical hypothesis, but there are basically no studies that utilized an adequate sophisticated methodology to, for example, to differentiate between the effects of parental incarceration and the effects of, I call them here confounding factors, meaning the effect of risk factors that are often correlated with parental incarceration. In fact, most research that examine the impact of parental incarceration, parental involvement with the criminal justice system, I should say, on their children lacks methodological rigor. Previous studies have been limited in several ways. Usually hypotheses have not been well defined. Usually they depended upon small samples, no representative samples. They had a cross-sectional design. Often used measures to assess, for example, psychopathology or other outcomes that were not standardized. This is a very important point, is related to what I said before, they did not adequately measure confounding factors, so other risk factors that might, for example, explain the relationship between parental involvement with the criminal justice system and children's negative outcome. Also, many studies have used convenience sample, and a lot of studies actually did not directly interview the children. They used other caregiver. They used the caregiver as a proxy for the child, meaning they use the caregiver, could be a parent or a grandparent, often in incarcerated population. So they use other caregivers as informant for the child. So just, the result is that they only have secondhand accounts of the children experiences or children's outcome. So most studies that have been done so far lack generalizability. Another important point is that, I think it's related to what I said before, most research on families of people who are involved with the criminal justice system focus on people who are incarcerated for long periods of time, usually more than a year. But this type of population involved with the criminal justice system represents only a small fraction of the whole population of people involved with the criminal justice system. For example, in 2009 in New York State, 2009 is, I think that the study I'm going to talk about was about to start in 2009. So in 2009, more than 70% of people arrested in New York State were arrested for minor crimes, like misdemeanors. There's only less than 10% of people who were arrested for severe or violent felonies. These are then the people who end up spending a long time in jail. So that year, there's only about 5% of people who were convicted of any crime in New York State and then received a prison sentence. Despite the high rates of, the point is that despite the high rates of arrest and despite the high rates of people spending some hours or some days in jail, the people who then end up spending a lot of time in prison, it's a very small fraction. And the numbers in New York State are consistent with the numbers in the rest of the United States. These are some other, let's say, limitations of previous studies of families of parents involved with the criminal justice system. Something, I think this is similar to something I said before. It's a very important point. The lack of, the lack of a rigorous studies, of a rigorous design, for example, of a longitudinal design, does not allow the differentiation between the effects of arrest from the effects of other risk factors that are often correlated with parental arrest, such as, as we said before, race, poverty, obviously disruption of parent-child relationship, difficult and unstable living conditions, being, stigmatization, like being stigmatized because your father or mother was arrested, etc. I mean, this is just to mention a few. It is very important if you want to if you want to intervene, if you want to do something about children of parents who are incarcerated, it is very important to differentiate between risk factors, and really understand why are children of people involved with the criminal justice system, why do they have higher rates of psychopathology or other negative outcomes? You have to understand what's going on. And probably a final limitation of the existing literature is that The literature traditionally focused on risk factors, which is obviously a very important thing to do, but it might be of equal importance to understand protective factors that might enhance resilience in children of people involved with the criminal justice system. There has been very little research to, for example, to study positive outcomes among children of parents who are incarcerated. I think we can skip the rest, but I guess this is a final limitation of the previous research, that there is no coherent theory, there's no coherent model to inform preventive or therapeutic interventions with children of children of parents who are involved with the criminal justice system. And the lack of a model that can be tested with with rigorous research is problematic, just because and I think something that I mentioned several times, risk factors do aggregate with each other. Risk factors cluster together. This is the model that was conceived by the principal investigator, Dr. Christina Hoven, when the study was originally designed, the study I'm going to talk about. We don't have to talk about every variable in this model, but I think this just gives just suggests what I just said, how risk factors are often correlated. There's risk factors at the parental level on the left. As you can see, it's not only about studying criminal justice system involvement, but other important risk factors should be examined, such as the involvement, the criminal justice system involvement of other family members, and then of course parental psychopathology, parental substance use, and domestic violence, poverty, and so on. Then the question is, like, how are these risk factors correlated with each other, and how are they collectively associated with variables that are measured at the child level? See, again, these are a long list of risk and protective factors that can be found in children of people involved with the criminal justice system, and how do all of these factors then are associated with negative outcomes in children of people who are incarcerated. There's, I think, to the best of our knowledge, there's no study that tested with a reliable research design a model of what could be happening in families of people that are incarcerated, and how are all the risk factors correlated with each other, or moderating each other, or mediating each other. So the stress and justice study, this is how we call the study that I'm gonna talk about. So in response to this lack of rigorous knowledge and rigorous research, and all the limitations I just talked about, and also in response to an interest of the principal investigator Christina Hoven in an interest in understanding the transmission of trauma from parent to child, our group, the Global Psychiatric Epidemiology Group, conducted 2 independent longitudinal studies to examine the effects of maternal and paternal criminal justice system involvement on their children. The maternal sample at baseline had 462 mothers and child dyads. Paternal sample at baseline had 300 father-child dyads. More or less, half of each subsample are parents involved with the criminal justice system, and more or less half of each subsample are parents who are not involved with the criminal justice system, and their children, of course. The studies were funded by the National Institute for Drug Abuse. They're collectively known as the Stress and Justice Study. The study is one of the general overarching aims of the studies is to overcome the methodological limitations of the previous literature, in order to provide generalizable findings that are obviously relevant for policy intervention, to reduce negative outcomes in children of people who are involved with the criminal justice system. The studies are longitudinal, and a unique feature of the study is that the study are designed to collect a representative sample of parents involved with the criminal justice system, So they're designed to collect a representative sample of parents with children in the age range of 9 to 15 that are arraigned in the Bronx Criminal Court. I just put here this map for people who are not familiar with New York City. This map shows the 5 boroughs of New York City as Staten Island, Brooklyn, Queens. This is Manhattan. The Bronx is the northern part of New York City, is the most northern county. The South Bronx corresponds more or less to this area. The Bronx, it's an interesting place to do a study on parental involvement with the criminal justice system, because even though the Bronx has only 16%, more or less 16% of the New York City total population, the Bronx accounts for more than 25% of all arrests in New York City. There's variation also within the Bronx from one area to another, but most of the people living in the southern Bronx are self-identified as belonging to ethnic, racial and ethnic minorities, such as actually about 60% of people are identified as Hispanic and 30% as African Americans. So the main objective of the these studies, again, just to reiterate, is to understand the impact over time. So to understand what happens over time in children of people who are involved with the criminal justice system. Do they have higher rates of substance use? Do they have higher rates of psychopathology like depression, etc., anxiety disorders? Importantly, do they have higher rates of criminal justice system involvement? Meaning, are children of people involved with the criminal justice system, are they also more likely of ending up being involved with the criminal justice system themselves? I don't know if I mentioned it before, but involvement with the criminal justice system tends to run in families, like psychopathology does. Like psychopathology also tends to run in families. So one of the longitudinal main aims of the study is to understand, again, the interplay of the different risk and protective factors, in particular, the accumulation of risk factors associated with parental involvement with the criminal justice system. And as I said before, it is important to study parental involvement with the criminal justice system as a risk factor for negative outcomes in their children. But parental involvement with the criminal justice system doesn't occur in isolation. It doesn't occur in a vacuum. Is most of the time, if not probably always, correlated, strongly correlated with other risk factors. I just reported here a few, like poverty, drug and alcohol use, stigmatization, housing instability, lower socioeconomic status, negative parenting, child abuse, etc. So this is racism. So this is really just to mention a few. And from a public health and social work perspective, policy-driven decisions that regard children and youth, especially those at elevated risk of negative outcomes, should be based upon, sound scientific data, which this study will hopefully generate. So I will show now a lot of tables. So these are bivariate analyses, meaning that we, at this initial phase of analysis, we are simply comparing indexes versus two controls. When I talk about parents, the first two slides are about the parents, the baseline parent data. Indexes are parents who were involved with the criminal justice system. Controls are parents who were not involved with the criminal justice system. When I will talk about the children data, index children are children of parents who were involved with the criminal justice system, and control children are children of parents who were not involved with the criminal justice system. As I said, I'm just going to show simple bivariate analysis comparing indexes and controls, and the results are are shown in the whole sample, meaning the maternal sample and the paternal sample together, and then stratified, if you want, by subsample. So results that were the results in the maternal sample and in the paternal sample. For categorical outcomes such as major depressive disorder, categorical outcomes, I mean, people either have the disorder or do not have the disorder. I'm going to show results from chi-square analysis for continuous outcomes such as, for example, age or symptom counts, like this type of outcomes. I'm going to show results from a t-test. And yeah, unfortunately, the results for chi-square and t-test are organized slightly differently, but you will see. So when it comes to psychiatric disorders in parents, you already see that there's some clear differences between indexes and controls. So first of all, I'm showing in red font results that are statistically significant, and in a bold black font results that are marginally significant. You already see that there's a pretty striking differences between index fathers and index fathers. For example, only index fathers have higher rates of unipolar mood disorders such as major depression and dysthymia, while what you see is that mothers have higher rates of hypomania and bipolar 2 disorders. If you find significant results in the whole sample, it's probably because the mothers are driving these significant results. So you already see that there's some pretty interesting differences, if you want, between mothers who were involved with the criminal justice system and fathers who were involved with the criminal justice system, which are obviously important to understand if you want to intervene on their children. These are other psychiatric disorders in parents. What you see here instead is that both index mothers and index fathers have a much higher rate of different kinds of alcohol abuse, of variables related to substance abuse, such as alcohol abuse, drug abuse, drug dependence, and alcohol dependence, both lifetime and in the past year. There's also a difference for nicotine dependence. So what this table shows is that index parents, no matter if they're mothers or fathers, have much higher rates of substance use disorders. Again, this is probably a good example of what we said before, how risk factors correlate with each other, right? So it's not only, we shouldn't focus only on parental involvement with the criminal justice system. And what these the first two tables I've shown indicate is that parental involvement with the criminal justice system is highly correlated with other risk factors, such as mood disorders, both unipolar and bipolar mood disorders, and substance use disorders. And we show now the results in children. So all of the following tables would be about the child baseline data. Something that I would like to mention is that I'm not talking in detail about each individual variable, also because we will be here like for 3 hours. And also I don't know if it was clear that the variables that I'm showing in these tables in this presentation, I'm only showing variables that did show significant or marginally significant differences between indexes and controls. But these variables represent only about, I would say, 10% of all the variables that were assessed in the stress and justice study. Obviously, for simplicity and because of time limitation, I'm talking only about variables that did show significant differences or marginally significant differences between indexes and controls. But there's a lot more variables that were assessed and analyzed. And something else I wanted to say is that I think my goal here is to give some sort of a general overview of what might be going on, in index parents and also in index children compared to controls. Because if some of you are interested in, any of these variables, then you can write me, or we can talk about it more. Like we can talk about it, more at length. And maybe there could be collaborations if you're working on similar data from other studies. So the goal here is really just to give a pretty general overview of what might be going on when we compare index parents to controls and index children to controls. So going back to the results, I'm just showing this demographic table just to show that index children compared to controls children do not differ in terms of gender and age Again, as I said, age is a continuous variable, so that the results are organized slightly differently. Indexes are here, controls are here. You see the mean and the standard deviation, and then the t-test. There might be some differences when it comes to racial and ethnic groups. Comparing indexes and controls. This difference is probably not a big deal. It's just, an indication that when if you run a more advanced analysis or more sophisticated analysis, you should control for race, or maybe you can also stratify your results by race. Anyway, there are different ways to deal with differences in terms of percentages of race groups across indexes and controls. So this is the first outcome. This is obviously one of the main outcomes, is the children's own involvement with the criminal justice system. It's one of the main aim of the study. What you see is, in fact, that index children have much higher rates of involvement with the criminal justice system compared to control children. What this means is that children of people who were involved with the criminal justice system are much more likely to be involved with the criminal justice system themselves compared to children of controls. You see that especially in the maternal sample. Although you see similar results is also in the paternal sample. For example, children of fathers involved with the criminal justice system are much more likely to be searched on the street or in a public place by a policeman. Children of mothers involved with the criminal justice system are also more likely to know other people involved with the criminal justice system. So this is an important finding, probably one of the main findings. It's really the fact that it is true, also in this sample, that children of people involved with the criminal justice system are more likely to be arrested, at a pretty early age. Remember that these are children in the age range from 9 to 15. So it's a relatively young age. They already show higher rates of involvement with the criminal justice system compared to children of controls. Another important outcome, which is correlated with the previous one, is delinquent behavior. There are different scales of delinquent behavior that were examined and assessed. Again, we don't have to go through all of them. The main point here is that, especially in the maternal sample, index children report higher levels, higher severity of delinquent behavior compared to controlled children. So children of mothers actually involved with the criminal justice system are more likely to display delinquent behavior compared to children of controls, children of mothers who were not involved with the criminal justice system. And interestingly, you find this the fact only in the maternal sample. If you look at the paternal sample, you see that none of the findings is significant. Again, this speaks to the often like the complexity of the studies, and like if you simply looked at the whole sample, like lumping together mothers and fathers, you would have not found any effect. But if you then stratify by the type of sample, so maternal and paternal sample, you do see that you find an effect exclusively in the maternal sample. These are obviously important factors to keep in mind if you're planning in intervention, or if you're dealing with public
Lupo,
health.
this has been so interesting. I'm just going to moderate the time here,
Yeah,
and we'll save some time at the end, because I do think
How much time do we have? Sorry.
Till 1 o'clock.
Okay.
So I want to give Tawandra some time to talk, but just I'll come back and ask a question later about uniqueness of the maternal sample.
Yeah, of course.
That could be. So thank you very much. Tawandra.
Yeah, of course.
Okay, you can see them, right? You can see my slides. Let's see. Okay. So I'm going to switch gears just a little bit, but honestly, there's some overlap in what Lupo just discussed and what I'll say. So again, if the slides were overlapping, I'll skip through those just for time's sake. But I'm going to talk a little bit about implementing drug screening practices, addiction treatment, and transitional support in correctional communities. So this is for people who are getting out of prisons and jails. And I have the most experience with the population in the New York City area. I won't go through my outline and I won't go through this because now you have a better sense already of the adult correctional population, but I'll talk a little bit about the problem. The criminal legal system is increasingly used to house people who use drugs, including people who have a substance use disorder, who have been diagnosed with a mental health condition, or sort of exist along the margins of society. These are marginalized populations, so minoritized populations, people with disabilities, people like that are overrepresented in the legal system in the United States. The problem is there are limited assessments and very few people receive adequate addiction treatment services while they're incarcerated, even though incarceration is a common experience for people who use drugs, and services are not necessarily evidence-based. And what you'll see is this revolving door where people are in and out of the correctional system, not getting the services and support that they need. Another problem with the legal system is that the risk for experiencing incarceration isn't borne proportionately. Not everyone is at risk for experiencing incarceration. For instance, when you look at men who are incarcerated, in their lifetime, 1 in 9 men in the US generally will be incarcerated, compared to 1 in 17 white men and 1 in 3 Black men. So again, this is a common experience for Black men as well. And when you look at women, you can also see the disproportionate rates of incarceration among Black women, whereas 1 in 18 compared to 1 in 111 among white women. And so the prevalence of drug use among system-involved populations is pretty high. It's 5 times higher compared to the general population, and more than 80% of people who are incarcerated report lifetime drug use, and more than half, so about 53%, meet the diagnostic criteria for a substance use disorder. Also, substance users typically become involved in the justice system due to having an illicit substance on them, for just possessing it, for being charged with illegal distribution, or doing something that was done to support an ongoing use. So property crimes, sometimes violent crimes, things like that. However, even though they're much more likely to be incarcerated, the usage rates are much lower among Blacks compared to, well, they have similar usage rates, but higher rates of arrest. So for instance, when you look at the marijuana rates, even though it's being legalized in a lot of places in the US, Blacks who use marijuana at about 1.3 times the rate of white Americans, but they're 3.7 times more likely to experience an arrest due to that marijuana usage. And I can give you the example of what happens when you're incarcerated, and I'm using the Wisconsin correctional system as an example. So when you are arrested for drug use or any other offense, you go through the process of your reception and orientation. That's when they are supposed to do assessments to see what your custody level should be, like what kind of services and supports that you'll need when you're incarcerated. And then they're supposed to give you the education, the treatment, the training, basically address all of the issues that emerge during this reception period. As you prepare for a release, ideally, they're supposed to continue these addiction treatment services, especially, and then there's supposed to be some continuation of care and services upon release, which rarely happens. But I want to talk a little bit about the overall goals. So what are the goals when you're being assessed during like that first stage? And it's to determine the level of supervision of clients. And I should remind everyone that for correctional institutions, which this talk is primarily focused on, they're not public health agencies, right? So their goal is to improve public safety. And so to protect the public from people who are incarcerated. But they're also supposed to identify clients in the system who are in need of that educational and vocational support. And this is where it gets a little dicey. They're supposed to match the client. So anyone who's incarcerated is supposed to be matched with the level of severity, with intervention and treatment services. So people who are in need of more services and support should be getting more services and support, and vice versa. People who need less should be getting less. And rarely is that done. I'll skip this slide just so I can talk more about the treatment in these environments. So less than 11%, I would say around 10% and change of the incarcerated individuals with substance use disorders specifically receive treatment. So very few people who need it are receiving it. And for instance, for medications for opioid use disorder treatment, they're not widely available. Correctional institutions are still largely resistant to services like this that are called harm reduction, and I'll mention why, and I think in a couple of slides. So there's an underutilization of medications and other harm reduction strategies, even though they've proven to reduce problematic substance use in and outside of incarceration as well. I will give an example of what's called a therapeutic community because this is something that has proven to show some improvements. These are substance use treatment facilities. They are people who are part of these communities are separated from the general population, so they're housed separately. But what's interesting is we know, like, there's a lot of evidence that suggests that these are useful communities, meaning they reduce recidivism, they improve relationships, they reduce substance use. The problem is, like, there are a lot of restrictions around who can be part of these communities. You have to have a history of substance use, of course, but not necessarily be diagnosed with an SUD. These are only for people who show the best behavior. So these are people who can't have any infractions while they're incarcerated, so no or few misconducts, and they have to be extremely close to being released. So within 6 months of being released from incarceration, and agree to work while they're in the program. So there are all of these restrictions, and if someone is really suffering from addiction, they may not meet these criteria, even though they are in need of services and support in communities like this. And we know that substance use does happen during periods of incarceration. Although it's lower than in the community, it's largely an access issue. But the reason why it's problematic is because when people do use substances during incarceration, they're more likely to do it dangerously. So they're not paying attention to, like, how much they're getting. They will share needles because they're just not widely available. And they may use something that they haven't used before, and so they may not have tolerance in their system. All of these are problematic for overdose rates. And they get them largely through correctional officers who are bringing them in from the outside and other inmates. And again, another problem is it's considered misconduct. So if they're caught, then they'll face even more penalties, even lengthening their sentence. I'll skip this slide and talk a little bit about substance use in the reentry period. So about 95% of the people who are incarcerated return to their community at some point. So largely these are people who will be part of the general population again. They tend to return to high-risk communities. So communities where, again, they access drugs in an unhealthy way, and they have limited options in these communities for addiction treatment and support. There are also a number of community service supervision requirements for people who experience incarceration that also are pretty restrictive and can result in being reincarcerated. This includes, like, attending mandatory substance use treatment sessions, meeting with your probation officer or parole officer, and you can be sent back to prison or jail for missing any of those meetings, not necessarily for committing another crime. And also family reunification has become problematic for people who are using drugs. There are a lot of unresolved issues, and a lot of family members live in public housing. And a lot of times people with felonies are not able to live in those communities as well. So that can be problematic as well. The post-incarceration overdose rates are exceptionally high, especially 2 weeks post-release. And so that's why the period when someone is moving from custody to the community is incredibly important, so that you can try to address these kind of things. If you look at the comparison between 2 weeks post-release, this graph is comparing members of the general population and members who were recently incarcerated. And you can see that the overdose rates are much higher 2 weeks post-release, and they're also elevated 1 year post-release, but not as elevated as among that 2 week high-risk period. I'll talk a little bit about harm reduction. Basically, these are strategies that are designed to reduce the negative effects of substance use. A lot of correctional institutions don't permit them, and they say it's because they don't want to sort of approve of any drug use at all, whereas harm reduction strategies aren't abstinence only. They're basically designed to say, you know what, we want to center this around the person. Not everybody is at the same place. Some people are still using, but we can help you use it safely, so that, like, you don't overdose or something like that. But again, very few correctional institutions are well aligned with harm reduction strategies. So I'm just going to go quickly and show a couple of findings from a pilot study that we did with formerly incarcerated individuals who are living with HIV in New York City. So just quickly, around like more than 500,000 people are released from correctional institutions each year. They're 3 times more likely to be infected with HIV compared to members of the general population. A large proportion of them have a history of substance use and have been incarcerated for committing a drug-related offense. And so what we wanted to do was inform and adapt a prevention intervention for people who have HIV. And we used some quantitative and qualitative data to inform our intervention. We looked at the time to first drug use. And again, that 14 days for our sample was very crucial too. But more than 30% of our population used drugs within 1 day after release. So they're going back to it right away. And within 2 weeks, half of the people in our sample of more than 120 people had used drugs. When we did qualitative interviews with them, they told us about the drug enticing environments that they go into post-incarceration. And what happens is most of them do not have control over where they go. They're assigned housing by the Department of Corrections. And so they're going into a lot of homeless shelters in New York City. Some of them are called SRO, single residency occupancies. And so that's where they're accessing drugs, even though the Department of Corrections has a zero tolerance policy. And so they're getting it through their networks and they're not necessarily using drugs in a very healthy way. So the purpose of our study, we wanted to look at a few things. We wanted to look at improving ART adherence because substance use is a predictor of poor medication adherence. We also wanted to try to reduce that problematic substance use, and I won't talk at all about condomless sexual behavior today. And something about harm reduction principles, because this is what we really use to guide our intervention development. We made sure that we did a comprehensive assessment of their needs around addiction treatment specifically, because we think that's really important. When you're trying to develop treatment plans collaboratively, we centered their experiences. So that's why we collected that information before we designed the intervention, because we wanted to make sure that we weren't just like doing what we thought was important and should be our priorities, but we wanted to reach out to them. One of the issues with people who experience incarceration is that they're systematically excluded from public health surveys and national databases. So you have to go directly to the source in order to get this very crucial information that's needed in order to inform programming. We wanted to do something that correctional institutions wouldn't do, which is discuss the importance of cleaning needles for people who are injection drug users, because that's really a very critical mode of HIV transmission for them, and not focus specifically on abstinence, which is what you'll find in correction settings. We wanted to meet people where they are, and not everybody is ready for recovery at that stage. And we wanted to respect that, but also find ways to identify triggers so that they can help manage them. So just briefly, we did we designed 2 interventions. We did a brief one that was only 1 session focused exclusively on ART adherence. So taking the medication as prescribed and on a very regular intervention. We talked about what HIV does to your body, why adherence is so important, because for people who have HIV, they have one of the most strict medication regimens where you have to take at least 95% in order for you to get what's called viral suppression, meaning that HIV is no longer identifiable in your blood. And so the first 2 sessions of both interventions were the same. For the 3-session intervention or adhere, we also added sessions on substance use, on harm reduction, and then session 3 was on condomless sexual behavior. So we recruited participants from New York City community-based agencies. There are a number of agencies there that work with people who experience incarceration and who have HIV. Here are some of our inclusion criteria. These were adults who had HIV, who had a history of drug use, and who were released from correctional institutions within the previous 5 years. We interviewed them at a few different time points, and they were compensated. I won't go into this. Basically, about half of the people who we initially enrolled were eligible for the study. We collected data on a range of behaviors, especially on substance use. And here, out of the 30 people who were randomized to either the 3-session or the 1-session intervention MACE, you could see that they were pretty similar except for in the transgender category. But when you looked at sexual minorities overall, they were equally spread across the two interventions. And a lot of people in our samples, they were living with HIV for a very long period of time, for decades, which is very interesting because when I first started doing research in this area, an HIV diagnosis was practically a death sentence. Now it's become a chronic condition, largely because so many of the advances in medication. And I just want to say in the last few minutes that we did see some improvements. We saw improvements in medication adherence, especially for people who were in the brief intervention, which was a bit of a surprise. But for the intervention that was longer, that is the only one that included the content on substance use. And you can see that like we saw a lot of lower reports of drug use in the past 3 months. So we can say that it definitely has potential, like using harm reduction strategies has potential to reduce it. And that's my next slide, that if you use these strategies, you know, if you make these interventions that are largely participant centered, like they can have potential. But we also noticed that most of our participants had already been linked to care. And if they weren't, we provided that linkage, and that was important too. And I will, in my last minute, I guess, talk a little bit about what we are doing next, because we did find still some deficits, like, okay, there are ways that it can be improved. One of the things that I noticed that I didn't point out, sorry, in one of the previous slides, is the vast majority of them had some kind of experience with substance use treatment, even though most of them used when they came out again. And so that kind of got me to thinking about what else can we do to help make sure that people aren't at risk for overdose when they're coming out of correctional institutions. And so one thing that I decided to do is use a tool that has been validated in other populations and sort of use it every 3 months for up to a year to measure substance use trajectories among people who are getting out of prisons and jails. And so this was the next study that was funded. And in this study, we're going to characterize their substance use over that 12-month period. We're going to identify the individual level, but also environmental predictors of post-incarceration substance use. And we're also going to identify any discrepancies between the good thing about the tool that we're going to use for this study is called the ASAM-PPC, American Society of Addiction Medicine placement. Oh my gosh, yeah, placement priority, I think, tool criteria tool is what it does. It produces a composite score that tells you the level of treatment that someone should be receiving. And we can look at their substance use trajectories to see how their substance use changes over time and to see if the services that they are receiving are consistent with their composite score, if that makes sense. But I'm happy to take more questions about that. I know like this was just kind of a quick
No, Tawandra, thank you so much. And it was so, you know, on your previous slide here, I just had a one comment that you know, came, because I come from juvenile justice research. And one thing that we really quickly picked up on is we could do great identification of need and whatever in a standardized, you know, systematic way, but it quickly became the linkages to services. So maybe in your new study, if you can somewhat even qualitatively capture the linkages to community providers that they're having or the lack thereof as it relates to their substance use trajectory, it might explain why the trajectories go certain ways, because those linkages to community providers when they're not incarcerated, I can, if they're few and far between for juveniles, they're few and far between for adults as well. But I really appreciate you sharing your wealth. You seem very busy in your research right now. You know, Lupo, there was something related to your work that I found really interesting is the high rates in the mother sample index compared to the controls as it relates to the high rates of bipolar in those disorders that can have some type of I would say a higher impact on the mother's ability to parent and child. And you also saw that the mothers of the indexes who are loaded with this psychopathology of bipolar 1 and 2, that they're more likely to get involved. And, you know, it's obviously the thing is the younger you are and the earlier your involvement in delinquent behavior is like a worse trajectory, going forward. So you might want to explore looking at the parent-child bond as explanation.
Yeah, for sure. Yeah, actually, there were quite a few unexpected results. One of the unexpected results was a higher prevalence of major depression in fathers. I mean, if you consider that major depression and major depressive episodes are in general way more prevalent among women compared to men, well, the opposite is true for bipolar disorder. That's a very unexpected result. And the same was true for the very high rate of substance use also in the maternal sample. Again, if you look at the data, if you look at epidemiological data, substance use disorders are usually way more prevalent in males compared to females. But there were very high rates also in the maternal sample. And I didn't have time. And again, I'm sorry. I'm sorry. I took time away from Tawandra's presentation. I for some reason I thought I had 45 minutes. So I'm sorry. But there's a lot of results in children that I didn't show, and you do see that in fact children of mothers involved with the criminal justice system seem to be at a higher risk compared to children of fathers who were involved with the criminal justice system. And I think, it's going to be interesting to, try to understand why. It might be that, again, if you look at epidemiological data, it is in general less likely for mothers to commit crimes than for I mean, it's less likely for female participants to commit crimes compared to male participants. Obviously, outcomes such as antisocial personality and stuff like that, these are also more prevalent in males. But so what I mean is that if you have mothers who are involved with the criminal justice system, they might be pretty severe in terms of underlying.
Well, that's what I've seen as far as I've looked at it in terms of gender paradox. I mean, Tawandra, one of your slides showed that the likelihood, and there are always social selection biases of that, there's probably a lot of things that'll keep a woman out of or a young girl out of the juvenile justice or criminal system. But if she gets in, that means she must be on the more severe side.
Yeah, exactly. And I think you see that. I think you start seeing that in the data also from this kind of simple bivariate analysis I was talking about. Yeah, it's pretty interesting. Yeah.
One, I thought another slide that was super interesting that you put up is that the reentry, particularly related to opioids right now, is given if they have any type of abstinence from an opioid and they use it in that first 2 weeks out, that's part and parcel what's been driving the high overdose rate has been a drive to keep people out of the system. And then while they're addicted to opioids, that's why we have such an overdose rate in the United States.
And I think too, fentanyl complicates the situation even more. You have people who have been incarcerated for a long time, some of them, and they're coming out into this new drug use landscape, and their tolerance has been reduced, and they're not, you know what I mean? And so they don't have a regular supplier, and so that is placing them at greater risk as well.
Wow. Well, are there any other questions from other people in the audience? If not, I really appreciate both of you taking time and I think your two talks really partnered well to thinking about, from an epi perspective, a transmission of criminal and delinquent behavior and family clusters versus, one of the major issues related to substance abuse. And I know you didn't talk about it as much today, but the HIV risk that comes with it, that I think it's important, very much addressing important things going forward with a clinical, kind of public health perspective.
Yeah.
So I very much appreciate all of you and hope everyone tunes in to some more of the talks. They've been really great so far.
Thank you.
All right.
Take
care. Thanks, Tawandra. Thanks, Lupo.
Thank you.